I'm Mary. I'm 36 years old and I live in Connecticut. I was diagnosed with Wilson disease in 3rd grade around age 9. I've run the gamut with Wilson disease treatments. When I was first diagnosed, I went through chelation therapy in the hospital to get to a stable level. After that, I started on penicillamine from about 3rd to 5th grade, with my parents managing all the timing of the medication and telling me when I could and could not eat. I had to fast 2 hours before taking the medication and 1 hour after. Then I could eat a meal. Repeat that 2 more times each day for each dose, and you can see how it gets complicated for anyone, let alone a child. I've been doing this my entire life. I switched from penicillamine to Galzin, a prescription zinc therapy, because it's safer not to be on chelation therapy. I did great with Galzin and stayed on it for years through high school. But as I got more active, I played a lot of soccer and basketball. It became harder to manage the strict timings for eating, fasting, and medication with so many practices and games. When I was a college athlete playing soccer, it was nearly impossible. I couldn't get in a routine because every day had a different schedule. Practices at 6 a.m., team meals at set times that didn't match my medication or fasting schedule, a stringent travel schedule. I was part of a team, but often had to pass on team meals, and missing medication became quite common. All of that was happening, and I also got to a place where the medications I had been taking did not work as well anymore. I started feeling sick from Galzin. I would throw up after taking it on an empty stomach. To deal with this, I would often have a little something to eat. The trade-off was not vomiting with something to eat or eating with my meds. Either way, it wasn't as effective. My liver function and 24-hour urine numbers started going up. In my 20s, I was living all over the United States, jumping around between different doctors because I was moving and I wasn't following protocols as closely. I developed a tremor around the time I got pregnant. The tremor became worse and I developed neurologic symptoms I'd never had before. I started to slur some of my speech and lose my balance. As a NICU nurse, I was having trouble putting in IVs, which I had always been pretty good at, and it rattled me. I didn't like that my work was affected. I was started on propranolol for the tremors and was put back on penicillamine to get all the extra copper out of my body. I had to be on penicillamine through both of my pregnancies, which isn't ideal, and I couldn't breastfeed either time because of that. Since that happened about 5 or 6 years ago, I've been completely religious about the timing of medication, eating, and fasting. Just this past year, I had to switch from penicillamine to Trientine for insurance reasons when I got a new job. I actually like the Trientine a little bit more. I think it's helped my tremor a little bit more. I'm currently taking Trientine in the morning and zinc gluconate twice throughout the day. It's just a dietary supplement, not prescription zinc. My medication schedule is very rigid because of Trientine. Like all the other meds, works best on an empty stomach. To manage this, I've learned to wake up at 3 or 4 a.m. to take my first pill. I take my medicine and go right back to sleep. This cuts it down so that there are only 2 3-hour windows of waking hours when I fast. I always have a timer going on my phone throughout the day. The Trientine has to be refrigerated, so I take it out the night before and put it on the bedstand. I carry my zinc around in pill containers. I have one for every day. Refrigeration isn't something I really think about for daily life, but it is another consideration, especially when I'm traveling with my family. The treatments are working very well, not perfectly, but I'm leading close to a normal life. The small tremor I still have mainly shows up when I'm nervous or overtired. I did end up making a career change in part because of my Wilson disease. I decided to go into the case management side of nursing instead of clinical nursing, just because I didn't ever want the tremors to affect anything with patient care. I didn't want that worry or anxiety about whether it might impact my work with those cute little NICU babies, and I still miss caring for them so much. For me, an ideal treatment would be fewer doses, or doses that you can just eat normally with. Even once a day with food restrictions would be amazing. The combination of number of doses with fasting is the difficult part. I was very fortunate that the person I wanted to marry didn't carry any genes for Wilson disease. We are thankful that our children are only carriers. I'm hopeful that if my children choose to have children, that they don't have Wilson disease. But if they did, I'm also hopeful that the medications for treating Wilson's disease will be more conducive to everyday living. Thank you so much for listening to my story.